So we have here a young lady who is she's the better half. I say so, she's the better half of the Navtis. We had Prof. Mama's getting queasy now. Last night, we were having a discussion, and this thing came about. A lady went to an event and said, "Vous avez affaire avec Madame." So this time, nous avons affaire avec Madame Navti. Seriously, Phyllis is she's into Dr. Phyllis Navti. She's a pharmacist, also an educator. She's done a lot of work. She's based, like the Sheikh himself, all based in Qatar, but they crisscross the globe. One of the things I said earlier is that what are we doing to improve our situation back home? And Phyllis is doing exactly that in Buea. She's also an assistant professor at the Department of Pharmacology at Buea University. Pharmacy, thanks to their support, they're actually making sure that Buea University can also produce pharmacists of the future. But their passion for Phyllis is AI, also, how we can actually harness AI. So Dr. Phyllis Navti is the assistant director. She's a visiting assistant professor at the Faculty of Health Sciences at the University of Buea. And we're going to be looking at essentially my paperwork, the issue about generative AI, the ethics, institutional readiness in health education. Dr. Phyllis Navti, you've got the microphone. Could you put your hands together, please, for her?
Thank you so much, Chief, and good afternoon, everyone. It's a pleasure, as always, to be back with the CamDoc community. Because the chairperson is my lesson sister, and the rest of the crew are people I've been with for a very long time. So they're really my UK community, Chief, and everyone. So it's just really nice to be back here. It's a difficult act to follow, so great presentations from the previous speakers. So it's hard to have to do that after lunch. When I'm half sleepy, you're probably half sleepy, so just cut me some slack. So I'm going to be delving into education. So we've had the basics, we've had how AI can be used in clinical settings, and then we just have a flavor of how AI can be used from the point of view of education. So although a lot of what I've done so far with AI has to do with undergrad pharmacy and medicine, and also CPD, because in my second hand, I'm the assistant director of the CPD division in Cornell in Qatar. So I do a lot of CPD. So with those lenses, a lot of the AI, the scenarios I've put in is around using AI as a trainer. So I know a lot of you in all your roles, we will have nurses here, physiotherapists, you train. So how you can use AI as in that training setting. So to kick off, we're going to do some polling. So if you can just answer the question, yeah. So which best describes your first response when your child or trainee you're training says, "I asked ChatGPT for this"? So do you say, "Fantastic, you're very resourceful, you're doing your research," or what is your first response? Be careful. Good one. Lazy. Good one. Yeah. Hope. Positive. Oh no. Yeah. I remember with our kids, telling them, "No, don't use AI," and be careful. Yeah. So there's a lot. Very good. You need to use your brain. Yeah. So we don't want to get lazy. Wow. Okay. Wow. Very good. Okay. So to move on, because I've been told I need to, next minute. Thank you. Okay. How familiar, so we're delving into education, so and this kind of like just segues into that. So how familiar are you with these generational terms? Gen X, millennials, Gen Zs, Gen Alphas, baby boomers, so just want to get a feel. I understand the terms well. So most people here understand. I've heard the terms, but I'm unsure what they mean. So two people, not so. I know some of the terms are new to me. Okay, and yeah, so 20. So most people understand the terms well. Okay, could move on to the next one. Which generation are most of today's health profession learners? So the people you train at work, what of these generations, which of these generations do you think they are? So Gen Zs, okay. You have Gen Xs, millennials. Hopefully you don't train any of the baby boomers. Yeah, Gen Zs, Gen Alpha. Okay. Yeah. All right. So I think Gen Z wins, so we can safely move on to the next one. How confident are you that your current instructional methods meet the learning preferences of today's learners? So again, anybody you train or coach at work, how confident are you that, the methods you use match them? So again, somewhat confident is winning, not confident, unsure, very confident. Okay. Yeah, so it's a good, somewhat confident is winning. So I think we have a good feel. And next one, please. Which generation is most likely to be described as AI natives? Gen Z, Gen Alpha, I don't know. Okay, so majority Gen Z, Gen Alpha, and Gen Z are kind of, head on head. So take a couple more. So we've got 23 of 29 anymore. Okay, so it looks like, a tie between Gen Z and Gen Alpha, but the right answer is Gen Alpha. Gen Z are digital natives, Gen Alpha are AI natives. So there's a slight difference, which we'll talk about later. Okay, so can we go back to the slide? So that's enough for now. Hopefully this time we can do some more mentees later. Okay, so we'll carry on. Okay, Stefan, I think I'm a bit... It should be, okay. Okay, see. Nice to have a Gen Z helper here. So we've done the polling and we're going to move on to this. Conclusion from the polling is that our trainees, students have grown up in the world of smartphones, Google, and now generative AI. And sorry, I did it too fast. So whether we embrace it or not, the expectations of learning have changed. So we're going to look at how that has changed later on. We'll delve into it. So basically, this is what my presentation is going to focus on. I just have 4 points. I hope I get through all of them. So we're going to look at how AI is transforming healthcare education. We're going to look at how healthcare students are using AI, so delving on the research and some research we did ourselves. And then we'll look at our readiness. So as healthcare educators, are we ready? And are our institutions ready? And then at the end, we'll just talk about, just an introduction to some, toolkits and things we could use as health educators in the short time I have. So AI transforming healthcare. So I put this first and then I took it out, but then I put it back because I think the previous presenters didn't necessarily touch on this, but I thought it was maybe a nice place to just quickly start with. So basically, I think we've established from all our great presenters earlier that AI is something that has been around for a very, very long time. So as far back as 1926 or something was when artificial intelligence was coined, and we use it in so many ways already. Grammarly, Netflix, when it pops up with recommendations, so it's in everything. AI nowadays, it just pops up. But what the game changer was Gen AI. So when ChatGPT and all of that came off, and AI started talking to us and producing content and reacting and all of that. So that was a big changer when it became came to our disposals. And this is what all of this is about: is generative AI that can produce content and interact with you real time. But the one thing I wanted to talk about was the LLMs, which is what we've talked about. So the modules that the language that speaks to AI is the large language modules, which is what a lot of the presenters and us talked about a lot about how that can then lead to bias, lead to rubbish in, rubbish out, really. So if it's not representative of our communities, the output we get will not be great. So again, you just need to be more aware of that. ChatGPT, for example, when Us talked about Mogo, that when we met him in Doha, he said something that I remembered. He said to us, ChatGPT is a California girl, for example, that it agrees with you most of the time, is very polite and wants to please you. So you need to be aware of that. So sometimes it would give you things to please you, or it's kind of biased towards what you want to hear. So it's best to try different AI sometimes to get your best output. So just be aware of it. And that was, he said that, the California girl wants to please you. So that was an interesting one. So I just thought I'll start with that and then move on quickly. So why AI is transforming health education? This is like a perfect storm. So the reason it's become such a big thing and we need to quickly get it as health educators is because learners have changed. So we've established Gen Zs, Gen Alphas are who will be training mostly. So they've changed. They expect a lot more from us. They expect interactive content, real-time content, up-to-date feedback. They don't wait to the end of the semester to get exams. So you need to be on top of it all the time. They've changed and they get bored easily. So we cannot do long lectures and all of that. Number one. Number two, AI capabilities have changed. So everyone now is more, even your patients will come and be able to use AI more than you if you don't kind of learn how to use it. So lots of reasons there. Healthcare has changed. So again, all of you have so much on your plate as medics and healthcare practitioners. The admin task, it just keeps coming, the expectations of your time. So again, as part of all of this, you need to learn how to use AI to not become a liability. As I like that bit, I noted that for your employers, because if you become a liability or a risk, they get rid of you. Number four, the educator role has changed. So this is the crux for us. So how you educate, again, it has to be interactive, interesting, patient-centered simulations. So a lot more has to happen than just taking a lecture, a slide of 20, whatever you putting and regurging knowledge. You have to be more on top of it. So all of that is really important for us. And productivity expectations. So all our efficiency, like us said, our managers, our organizations are demanding more of us. So we have to make sure we use AI to be able to meet this. Again, the question is no longer whether AI belongs in health education, but how educators can use it responsibly. So what is changing? So before, education was one size fits all. Now, personalized learning, we hear about that all the time. You need to be tailored to the person in front of you. We've moved from lectures to interactive learning. We've moved from information recall to critical thinking, static resources to AI-generated adaptive resources, teacher-centered to learner-centered. So a lot of times the teacher top-heavy, you give what you want, but now it's based around the learners. Manual feedback moved to AI-assisted feedback, and individual work to human and AI collaboration. So the best work is if you can collaborate with AI, but you have to be the human in the loop. So you cannot just give it all to AI. It's your content, like us pointed out. So AI is not changing what we teach or what is learned. It is changing how we teach, how we coach, how we assess and prepare future healthcare professions. So AI in health education, the impact and benefits, again, I think it's a repetition of what I've said. So the output of that, if we do it right, is personalized learning, improved learning outcomes. So students do better if you use AI right, greater efficiency, data-informed teaching, scalable and future-ready workforce. So we have a better workforce at the end of all of this. So I've just kind of put this there about, as an educator, this is sort of the paths you'd go through to be able to get in. Before you get to teaching, you have to plan your lectures or plan whatever content. You create the learning outcomes, very important. You design clinical cases for most of you. During teaching, you can generate polls, depending if you're here, you can have the mentee like I did, or at the bedside, you can ask questions, adapt learning level, and then assessment. So you have to do MCQs or whatever form, OSCEs, whatever you do to assess. And after teaching, there's grading and different things you need to do. So AI can help along all of that. And then as part of that, across all of that, there's admin work to do. which again you can use AI for, and there's research. So there's so much you can use AI for in your research. But the disclaimer, what I need to say is that you can use it across literature, search, and all of that, data analysis. But two key things is you need to declare it, because a lot of people would pretend that they did the work when AI did. So if you use AI to assist, you need to look at what the journal or whatever the convention is wherever you're putting your output, and declare the use of AI, and double check, because it gives you sometimes the wrong information. And also the confidentiality bit about just make sure you don't put patient data, which I think we all know already. So this is examples of how I've used AI in my teaching, and I thought I'll just quickly show you some. So for my University of Buea class that I teach pharmacy for, I teach lifestyle medicine. And one of the second pillar, or the first pillar I taught was nutrition, how to, as pharmacists, to read nutrition labels. So what I did was went to different pharmacies and got, the shop, I got like different things, the food items. So there was a milk drink, chocolate, fruits, plantain chips, and all of that. And I had them read the labels. But what I did was divide them into groups to do that. So in the past, to be able to create this group task, it would take me 2 hours to kind of put it all together, divide the groups, everything. But with AI, this group task and to put it out there took me 5 minutes to do. So I had the class list, put it in ChatGPT, put the items. In fact, I didn't even type them. I took a picture of them and said, create this. This is the output I wanted with my prompt. And in 2 minutes, I had this. So it was it's good in creating a lot of interactive content. So I do use it a lot in teaching. This is something which is actually more of a longitudinal exercise we did as part of the group. So another pillar of lifestyle medicine is exercise. So rather than teach them about exercise, which I did, so I used half an hour to teach them about exercise, got a coach who came, took them out, they did different types of, strength, different exercises. But then I wanted to get them to actually do it. So I gave them a challenge where for a 2-week period, they were walking. Again, in the past, I'd wanted to do this with the last cohort. I couldn't because I thought it's going to take too long to put this together. But then I used ChatGPT. All I did was use the Pacer app, put in this information. Within 2-3 minutes, I had the challenge as a thing, and I sent to them. And all of them joined and did this challenge for 2 weeks, and they were walking more. So it's just showing how you can use it in different things to improve your education. How African students are using AI. So we're going to talk about how we're using it. So up to 95%, put your hands up if you agree, that up to 95% of university students admitted using generative AI for at least some academic task. And you also agree that the remainder 5% are probably lying. Okay, so I think I expected most hands to go up to agree that they were lying, but I think it's 50-50. So half the room had their hands up. Okay. Hands up if you agree, students only use AI to cheat. No. Hands up, no hands. Okay. I'm glad because 2 years ago when I did the research and presented and I was speaking to my University of Buea colleagues, a lot of them were not, they were like, they shouldn't use AI, they were completely against, but it's moved, it's shifted now to, we need to understand how they use it, they should be using it, and it's just how well they use it. So most students are already using AI. So the data is out there, 70 to 95% use it, and they're not using it to cheat. Some are using it to cheat, that's for sure, but they're using it to practice, inquiry, production, knowledge acquisition. They're using it for a lot of good things sometimes, but the issues we worry about is academic integrity, reducing critical thinking, which is true. If you don't use some of your brain cells, then they become redundant. Reduce peer interaction, so a lot of isolation, which is a concern, and little or no formal training. The training is the issue on how well to use it. So again, we're not escaping this thing, it's here to stay. So this is research that we did, and I got into the research as part of my role in University of Buea. It was interesting because one of my colleagues in Doha, who I was mentoring for a PhD, she's doing her work on simulation. It turned out that her boss in her university in Paris had a Cameroonian boss. So they had this conference in Yaoundé about AI. So somehow she encouraged me to do this piece of research about AI use in Africa, and it worked out well. So I collaborated with my two bosses in University of Buea and found some other collaborators in Uganda and Nigeria, and we did this bit of research. So we did it across 3 African countries and 5 centers. And what the research looked at was just to explore how AI was being used, and this is the output. So in total, we had 130 students, and the key take-home of the quantitative findings was that 40% of them use generative AI, at least once a week. 94.6% had never received any training. So that's a concern. Awareness is high, and it's something that we need to know. Students are already using it, but we need to prepare them on how to use it. These are some of the open-ended questions, the answers to them. So a lot of them, I'll just let you read this, so I'm not reading it for you. So basically what that tells us is that students want to use it, they're using it, but they need to be educated and they need guidelines, they need the university to support them to use it correctly. The other thing as well, which I think was mentioned earlier, which makes me think about that settings, is the deprived class this year. I couldn't travel to Cameroon, I had to do it on, as a Zoom. So we're trying to agree how to do it, and the students couldn't do it from their homes. They had to still come into a room because guess what the cost of actually attending a 4-hour lecture would be for them, for their data, each student. Yeah. So when I spoke to the IT guys and the teacher, 40,000 CFA to be able to do a 4-hour lecture. So again, cost is a huge, huge disadvantage. So if CamDoc wants to do anything, support the university with some money for that. So again, students are ready. But are educators ready? No. So basically, I think that's what we're getting at. Are we ready? Health educators and institutional readiness. So students adopt generative AI faster. Educators, a lot of them don't actually know how to use it, and they've never. So it's really, really, the next part of this research is to look at how educators are using it. So we haven't done that yet, but I just looked at published research. So this is a systematic review, and source of different evidence from Africa is that 6 to 21% of institutions in Africa have AI-related policies. Most don't. So the few in South Africa that have, couple in Nigeria, but most African countries don't have policies at all in universities to support teachers. AI engagement remains at an early stage overall with lower engagement. Anglophone respondents, so a lot of the English-speaking countries, I think it's because of the South Africa and Nigeria, were mostly using it, and the students use it more than the lecturers. So basically, the summary of everything is that we need that. So the educators need to be educated to support the students, because how would you tell whether they're using it right if you don't know how to use it? So from the research, this is some of the voices these are quotes from the research I looked at. I can no longer give take-home exams. If one doesn't know how to prompt, could lead to inaccurate infos, yeah, which we all know. And another one said banning AI at university was like banning breathing. So students are going to use it. The educators need to get on board and know how to help support them. The next slide, I left this because it's interesting to show about hallucinations. I picked this up when I was going through my slides. Oh, the other declaration I didn't do is I used AI a lot to, prepare my slides. So you need to go through it with a fine-tooth comb. So I'm going through my slides, and I say to us, AI has given these people, I asked AI to give me pictures. It gave me names, and it gave me titles, which is all made up. So these names was not in the data. It just went ahead and did it. So I was going to remove it, and I thought it's a fun one to show. So sometimes it throws things in your stuff that you did not put in. You need to check it. So again, the challenges universities must address is faculty readiness, the curriculum, assessment, ethics and governance, infrastructure, and the rapid pace of change. So there's so much that is stopping them from actually how can I put it, making the use of AI institutional, but nothing is stopping them from going to train as individuals or us as trainers to go learn how to use it. So the challenge is no longer whether to teach AI, it is how to prepare, our educators. I cannot say that often enough. So universities, are struggling to keep up, and the pace of AI is outstripping institutional change. So students are just picking it and running with it, but educators red tape, red tape, red tape. And in Africa, in our setting, is the cost. So sometimes when I speak to my colleagues, is how they can access it. So the AI toolkit for your health educator journey. So I had the warning that I just have a few minutes left. So I'm just going to do this, and then we'll pick up some questions at the Q&A. So please put up your hands if you're involved in training any of this. So I should have maybe done that at the beginning, but my assumption is that most of our roles would involve training. So, few hands up. Yeah, I think most people would have someone who they do a bedside training or whatever form of training too. I was going to do some more polls, but it was really just to get more into the Gen Z, Gen Alpha nuances. So I'll present some of the data around that. So this is just to show the differences in the different generations and how, as an educator, you need to think about that when you do your content. So though this is about AI, it's also about pedagogy generally. So learning, the baby boomers use traditional lectures, the Gen X's, which I'm one of, and I think most of us are, we use lectures. The millennials, blended learning is how they learn. Gen Z's, interactive multimedia, and Gen Alphas are even more demanding. They want personalized AI-assisted teaching, so you need to bear that in mind when you teach them. And we were fine with face-to-face email messaging. Now they want visual content and conversational, real-time information. So again, as educators, if you take nothing back from this, it's just to kind of be aware that you need to tailor it, because a lot of us are different generations, so we need to understand where they're coming from when sometimes they say. And the other big thing that in Cornell, where I work, when we talk about the medical students nowadays, it's a medical school I work for, and the faculty is so upset because a lot of the medical students, the big one is work-life balance. I didn't put it in there. So you guys will do on calls, work, whatever. Now, end of shift, they go. And for them, they're not doing it because they're not conscientious. They're doing it because they don't want to get burned out. So for them, and they would argue that if I don't get burned out, it's better for my patients. So again, when you kind of get to understand that, you're thinking they're actually right. You guys, you're doing kind of the wrong thing. The institution took advantage of you and the systems and everything, but really the Gen Zs are coming to fix that, and Gen Alphas, they're not accepting to be burnt out. So again, something to be aware of. Yeah. So key insights about today's learners is basically that repeating. So they want real-time information, good information, multimedia information, and our roles as educators evolve from teaching, to facilitating, coaching, and just helping them consume the content. It's not about giving them slides to do it. I was listening to one of a podcast from the lady who is involved with the Chinese version, I think it's DeepSeek, and she was saying education, like slides and giving knowledge-based education, is a thing of the past. So if you're a lecturer and more than 50% of your lecture is information, knowledge that they can get from anywhere, you need to stop. So you need to rethink how you educate them. They can get the knowledge from anywhere. So your role is to help them to think critically and use it different. So again, today's learners don't need us to tell them what to do. What they need from us is to help question, evaluate, apply, and critically interpret the information they have. So to support them to arrive at that, not do it for them. So again, lots of recommendations there on how to integrate AI in higher education, faculty development, and students. So we all need AI literacy to be taught it properly. Clear policies, strengthen digital infrastructure, modernize assessment, and promote discipline-specific support. And in Africa, money. So support to be able to do that. A little bit on the prompt engineering. How am I doing? Yeah, okay, so prompt engineering, Oz mentioned something, we won't go into this about, and I think some of the other speakers, it's the whole concept of rubbish in, rubbish out, and I don't, it was mentioned that, I think again, it was also, one of the questions, I think, I can't remember now, said something about when the junior doctor put in a prompt or something, it gave a different output. When the consultant did, it gave a better output. And I think this has to do with the prompt engineering. So what is prompting? Is the art of giving AI clear instructions about your role, the context, the audience, and the outcome you want. So if you don't tell AI what you want it to do, you will not get it right. And that's pretty much what it is. So there are different frameworks you can use. CARES is the one I recommended because we're healthcare practitioners, right? So C, what is the situation? You need to give it context when you're prompting. Who are the learners, your audience, the role, what should AI become? You know, you're a nurse, you're a pharmacist, and you're teaching these people, and the expectation, what output? I want it so. I want nice guidance. I want whatever thing you want it to assess, you need to be specific. So a weak prompt will be create a teaching case on postpartum hemorrhage. That doesn't tell you much. But if you give it a little bit more detail, you get a robust information to work with. So that's what that is. And again, this shows the differences with a simple prompt and a more complicated one. And it's really just the amount of prompting you give it. So what I have done, because I knew I'd run out of time, is I've put together a prompt library for different prompts that you can use. I checked this. So at different times it worked. Emma checked it for me. I think it worked. So if it doesn't work for you, I can send the link. So I've put together prompts for different scenarios that you might encounter as educators. So I've done it for different specialties, for doctors at the bedside, nurses, pharmacists, different people. I looked at the attendee list and put together this prompt list that you can access from this code and literally adapt. So again, feel free, copy paste it, but then you can change it to put in what you're doing. So I thought it would be a useful resource you can take away with you. So if that doesn't work, just let me know. I can send the link. So it's on a Google Drive, and you can just access that as a playbook. So I'm going to leave you with this, just different quotes that remind us as our role going forward as educators. So education is not filling of a pill, but the lighting of a fire. So you don't pour into people, you just motivate them to start learning. Again, tell me and I forget, teach me and I remember, involve me and I learn. So again, multimodal. The illiterate of the 21st century will not be those who cannot read and write, but those who cannot learn, unlearn, and relearn. And the final one, I knew it's been something which every single presenter has said or will said, AI will not replace, I kind of adapted that for health educators. AI will not replace health educators, but health educators who use AI effectively may replace those who do not. So really, it's not a choice, it's just how you do it. And these are some of the references I used. And yeah, so that's me done. So thank you very much.